Put that way down for you. You are.
I want to move the camera.
That's fine, whatever. It's got to be plugged in though, because it was dead when I. We do have a extension cord if you need it.
I think I can make something work. Don't laugh at me.
Okay, sorry.
Don't laugh at me.
Don't laugh at me.
Thank you. Thanks, good.
Are we good?
It's recording. It says
Oh,
record.
okay. So, for those of you not here, we're starting on page 429 of the Therex book, and we're going to go, first we're going to talk about training people in awareness of their posture. Once you've maintained poor posture for a long period of time, that starts to feel like normal. Okay? And so to correct it feels abnormal. Okay? So it has a list of exercises there. Do you see that, James? It starts with axial extension. Are you on 429? Right here. Okay. So, go ahead and scoot forward so your feet are nice and flat on the floor. You always want to be sure that they have a good base. And you can work with them in sitting or standing, and you should work with them in both so that they have a sense of posture in both positions. And one of the first things we train people in is axial extension of the neck. That's going to get the longest colli, which remember is the stabilizer of your neck. It's really easy to overdo this exercise because it's a very small, short kind of a movement. People will stimulate headaches if they do this too aggressively. So I always warn people, it's a small movement, don't overdo it. Okay, and what you have them do is simply bring their head back. Pretend that there's a string on your head and it's pulling you up. So tuck your chin a little bit. There we go. And then come back. And bring your head back. And come back. Okay? Everybody do that. See what that feels like. And very carefully overdo it a little bit and see where you get that pull that can create the headache. Don't give yourself a headache.
I'm not going to.
Okay.
Is it helping?
Do you feel that? Everybody feel that? Okay. Sometimes it helps people to put a mirror, I know, to put a mirror in front of them, and if you get behind them, you should go ahead and tuck your chin. See how that feels? Up a little bit, right there. And they get a visual, and you give them some tactile cues and some verbal cues about how they're doing with it. Okay, so they get a multimodal kind of a learning experience. What's next? Axial? Thoracic extension? Scapular retraction. Now, when she brings her neck back, she automatically kind of sits up a little straighter. But we also want to work on scapular retraction. And it's not simply squeezing your shoulder blades together. It's squeezing them together and then depressing them a little bit. So use these muscles right here. Come back and down. right here. Look at yourself. I know, it's freaky. Okay, and then relax. What's the next one?
Pelvic tilt and neutral spine.
Okay. Remember the video we watched on the pelvic tilt? That guy, he was funny. One of the things you need to be able to do is to isolate that pelvic tilt. A lot of people, they don't get that pelvic tilt thing, that you have to isolate the pelvis from the thorax. I usually start teaching it in supine. So, in a moment, we're done with this, but I'm gonna have you lie supine. And first I ask them if they can do a pelvic tilt and see what happens, okay? Typically, they don't know what I'm talking about. So then I say, okay, I put my hand underneath so I can feel their lumbar spine, feel the spinous processes, and I say, okay, smash my hand, okay? Did you see what happened there? And relax. And smash my hand again. And relax. Now, what they're gonna do is they're gonna push with their feet to push the pelvis back. And that's okay at first, just to get a sense of what that movement feels like. But really, it's the abdominal muscles that need to contract to do that motion. So then we would go back and say, okay, I want you to tuck your tummy and try to smash my hand. Yeah, see, that's a little harder. You extend it there. Relax and try it again. There. Did you feel that?
Mhm.
Okay, and relax. Tuck your tummy and smash my hand. Okay, good. Okay, now when they talk about finding the neutral spine, you teach people about posterior pelvic tilt, but also anterior pelvic tilt. So arch your back up and arch it back and smash it back down. Arch up, smash down. Now find the middle, somewhere in between there. And I should be able to put my hand underneath your back. That's what should happen, because maintaining that normal lumbar curve is optimal posture. Okay. Okay. Go ahead and sit up. We can also do that in sitting, and I'll have you extend and flex. Slow. And extend, flex, and now come to a place in the middle, a little bit higher. Right there. Okay? So little bitty movements you're feeling so that you know what they're doing and where they need to be. They've got some visual feedback and they've got some verbal feedback. Then to make it even a little harder, let's come over to the wall. And I'm going to have you stand with your back against the wall. And you can bend your knees a little bit. And I'm going to have you smash. It's harder, isn't it?
Yeah. There you go.
There we go. And arch. And smash. And now come to the middle. Middle of that. There. Get your shoulders back and down. Feels weird, doesn't it? Okay. And then from there, you can start training them in, okay, I've got this posture, I feel it against the wall, now maintain that posture and walk around the mat. Relax a little.
Yeah, everything's. I'm not keeping my head straight.
You're
though.
not rotating a whole lot either. You can try. Kind of just relax with
If I
it.
relax, I lose it.
I know. So that's the challenge. You make it harder and you make it harder. At some point will start doing some lunges while maintaining that posture. Do some squats while maintaining that posture. You know, start doing lifting when they're ready to maintain that posture. Have a seat. What's next?
Thoracic spine.
Okay. What's it say?
Patient position and procedure standing. Position of the thorax affects the posture of the lumbar spine and pelvis. Consequently, the feel of the thoracic movement is incorporated in posture training for the lumbar spine. As the patient assumes a mild lordotic posture, hop him or hop breathe in and lift the rib cage.
Okay, okay. So what they're talking about, normally when you correct at the lumbar spine and the cervical spine, the thoracic spine kind of follows. But now you can add a little bit of challenge to that in, okay, I want you to take a deep breath and relax. Now as you take a deep breath, I feel a little bit of a kyphosis right there. I want you to pull that in as you breathe up. Pull in, pull in, pull in. Toward the front. Hey, try it. No. Okay, don't breathe right now. Okay. So straighten up right there. Oh, you had it a minute ago. There. Okay, now hold that and try to breathe in. And blow it out. Breathe in. Blow it out. That's hard for her because that was a little hard to correct right there. And then to add that breathing to it, it was really hard to hold it and breathe at the same time. Okay, good. Where are we now?
Total spinal movement and control.
Okay. So when you teach about postural awareness, you're really wanting them to tune into their spine and start to feel that again. You know, we typically just, whatever, you know, I am what I am kind of a thing. But we want to develop awareness. And so one way to do that, is your back okay?
Mm-hmm.
I know that you have some back problems, so let me know. I want you to bend forward as far as you can. Now, from here, I'm going to have her come up one vertebra at a time. So you're going to start. There you go. One vertebra at a time. And extend each vertebra as you come up, come up, come up. Roll your shoulders back and down and tuck your head. Not so, I wasn't going to hit you, I swear. That's not a therapeutic technique. Okay, good. Okay, so let's try that one more time.
Okay.
And this might be a good home exercise program. Come up one vertebrae at a time. Reach your neutral pelvis there, bring your shoulders back and down, and tuck your chin. Okay. Good job. I'm going to pick on somebody else now.
Okay.
And, it talks about postural support in here, and they do have some braces that you can wear to help correct posture. And if somebody has some really severe pain or that's posturally related, you might use some of those to help to retrain the muscles a little bit, but you don't want to use them very long. You know, the idea is for them their muscles to correct it not the postural support to correct it. But they may need a little help in the beginning. Okay, box 14.2. I need a body. Go through these. Body. Yeah, you're the cameraman, I see that. How you're being the cameraman. Okay. What do we got first? We're at page 432, box 14.2. So remember, we talked yesterday about if somebody has a forward head, they're going to extend to look up at the world, and their suboccipitals are going to get tight, aren't they? So I'm going to show you how to have them stretch the suboccipitals. So let's get her in good posture first. So extend here. Oh, that's fine. Bring your shoulders back and down.
Down's weird.
I know, down's weird. It feels weird. Doesn't feel normal. And tuck.
Or?
Right there. Okay. Now, when she's in this tucked position then, she's just going to look down, nod down, but stay in axial extension. I know. Tuck and nod down. And you should feel the stretch right in through here. Everybody do that. So you feel that stretch.
Oh, yeah.
I can feel it in my levator on the right side too. I know. If somebody, especially if somebody has chronic tension headaches, that will help to stretch those muscles out. If they don't feel much of a stretch when they do that, they can go ahead and apply some overpressure to get the stretch.
Oh.
Yeah, you feel enough stretch, that's why I didn't have to do that. Okay, what's next?
Levator scapula.
Levator scapula, and we're gonna stretch that. Read to me the directions.
Self-stretch with scapular depression and cervical flexion and rotation to the opposite side.
Okay, so we're gonna bring the shoulders back and down, do a chin tuck, and you're going to look down, keep your chin tucked, but look down, more.
I don't know if I can go in here.
Okay, is that it?
I think so.
Okay.
With the tuck anyway.
And then laterally flex away,
And cervical flexion and rotation to the opposite side.
rotation, okay.
And flex or
No.
just rotation?
Flex. And we're going to stretch this side, so then she rotates away. Feel it? Right in through there. Mhm. Now, this is a really good stretch. I do it a lot, and what you can do is stretch and rotate, and as you rotate, you can feel where it stretches, and you can find just that right spot. So everybody do that. Tuck, flex, rotate, and then just kind of slowly adjust your rotation till you feel stretch in the right place. And if you need to, apply some, that feels better to me, is to grab the occiput and pull. Yeah. Grab down here. And you can rotate your head, and that stretches that muscle in different positions.
scalings.
Mm-hmm.
Self-stretch with axial extension, side bend neck opposite, and then rotate neck towards the side of the position.
Okay. So, scalings, you're gonna tuck, you're gonna rotate, and then, oh, I'm sorry. Tuck, laterally flex,
Side bend.
Side
side bend, same thing.
Yeah.
And then rotate toward that side. And you should feel the stretch right down through here.
A little bit. Yeah. Right here?
Yeah, the levators, or not, no, I'm sorry, the scalings.
Next is back, major, and anterior thorax.
Okay.
Self-stretch with corner stretches or while lying supine on a foam roll placed longitudinally under the spine.
Okay. So everybody knows the corner stretch, right? And you can also do it in a doorway. When you do that, you've got to have good posture, okay? You can't just arch and lean into it. You've got to keep good form, okay? And then to do it with a foam roller, butt goes here,
My butt goes on it?
butt goes here.
Don't fall off.
Nice.
Right here? Like that?
Okay, and then go ahead and come on down. Okay. So you're working on stabilization while you're there, aren't you? Forward. Okay, and you're gonna come here.
Oh, that feels nice.
Isn't that nice? It really is nice.
Right here.
Uh-huh. And if you wanted to make it a little more aggressive, you might put a weight or two around here, pull that down a little bit. But they simply rest in that position. Remember that a low load, prolonged stretch works better than a lot of quick ones. So you have them stretch until they feel a little uncomfortable, and then cross your arms across your chest to rest.
Mine's just my balance. Like a
Uh-huh,
little wobbly.
uh-huh. And then when you're ready, go back into it.
They did that using weights at my clinical.
Uh-huh.
They had a girl do that every time she came in.
Uh-huh. And then to stretch the lats, simply go into extension or severe flexion of the shoulder. Because the lats are extensors of the shoulders, so you go into flexion to stretch. Okay.
Feel it more on my left side.
Yeah, I see you're tighter on that side.
Next, lumbar and hip extensors. We just did the lateral side, so.
You can
Next,
get up.
lumbar and hip extensors.
What's that?
We just did this one.
Yeah, I did lats. So lumbar
Actually felt good.
extensors. Okay. A couple different ways to stretch the lumbar extensors. One way is to simply lie down on your back. And you want them to stabilize their pelvis before they lift their leg, right? Why?
So they don't compensate.
You said back.
And to prevent bad form or injury.
Yeah, you've got to stabilize that pelvis, don't you? Because the iliopsoas is going to pull your back into extension if you don't. So tuck your tummy. Don't push with your feet. There you go. Now, bring your knee up to your chest and hold. hold on to it, and simply stretch. And you can pull as far as you need to.
That feels good too.
Mm-hmm. And keep your tummy tight as you let your leg back down. Keep tummy tight. Okay. Tummy tight, bring this one up, hold. You want to have a good 20-second stretch there. Tummy tight, and bring your leg back down. Okay. Those are single kneaded chest, or SL. How do they do that?
SK, single seated chest,
Yeah.
SKC.
Thank you. That might be an acronym or an abbreviation that you see. And then there's double kneaded chest. And then you want to tuck your tummy, bring one leg up, hold on to it, then bring the other leg up. Why would I not want to bring both legs up at the same time?
I don't know.
What's it going to do to her back?
It's gonna arch it more. wouldn't it?
Mm-hmm. It's a lot harder to lift both legs at the same time and maintain your
Stabilization.
stabilization. If you can, great, but when you first start teaching this, they're not gonna be able to. And then you're gonna tuck your tummy, bring one leg down, and then bring the other leg down. Okay.
Lumbar flexors.
Oh, there's one other way to do the lumbar extensors. Maybe get on all fours. People love to do that. Okay, and you simply have them rock back.
Like child's pose.
Child's pose.
You just chill out here.
Chill out. Okay, come on back up. And you can sit.
Lumbar flexors.
Lumbar flexors. Okay, what are the lumbar flexors?
Your abs.
Mhm.
Okay, so there's a couple different ways you can do that. One is to get on your belly. And
Down all the way.
you're gonna do a prone push-up. You're gonna keep your hips down and push up while keeping your hips down. Okay? You don't want those ASIS to come up off the mat, so push up, right about there. Can you feel the stretch in your belly? Okay.
It's burning my triceps.
Yeah, well, there's that too, okay, so that's one way. The other way, I'll have you stand up. Okay, you wanna have good posture, and up, and back and down, and tuck your tummy in a little bit, there you go. Okay, hands on your hips. And I'm gonna have you backward bend, but I want you to think extension first and then backward bend. So extension
up.
and then backward bend until you feel a good stretch
Yeah.
in those belly.
Can't go
in the
much
belly.
further.
That's fine, that's fine.
So if they have low back problems, would you just not do that one?
That's not true. And we're gonna learn about the spine in our next section. There's two different kinds of disorders. You can sit if you want. There's two different type of disorders of the spine, and one has a flexion bias, one has an extension bias. So extension is not necessarily a bad thing, and we'll talk more about that the next.
Because I couldn't do that.
Yeah.
Tensor fascia lata.
TFL. Okay. So in standing, stand and face the camera. What you have to do is extend the hip, so step back with one leg. Internally rotate the hip.
Which way? This one or this one?
This one. And then AB duction.
Whoop.
Sorry.
Like that?
And then that should stretch down the side of that leg. Okay?
Mm-hmm.
Okay. And so I'm gonna have you get in sideline facing everybody. So the TFL and the ITB, they do lateral rotation, they do extension of the hip, and they do abduction. So you have to go into the opposite direction. So the first thing you want to do is get them to extend their hip.
Can we do the other side?
Mm-hmm.
This knee isn't very stable.
Yeah, that's good because we're gonna do some wacky things
Okay.
with the knee too. Is this one okay?
Yeah.
Okay. So we're gonna extend the hip and rotate it towards me.
Yeah, I couldn't have done that with the other one.
You gotta keep that hip
Oh.
forward though. Rotate it out.
I don't think it goes
And
any
then
further.
drop it down. Drop it down. Let it drop down. Okay? And that stretches out that side. If you want to get more of an aggressive stretch, bend your knee. You bend that knee and let it drop down a little bit more.
Could you drop it out in front of her
No,
and not still get the
no,
ITB?
because TFL does what? Flexion. Did I say extension? TFL does flexion.
Like in my clinicals, they always did where they dropped it out in front for the TFL.
Has to be an extension, because the TFL flexes the hip.
Mhm.
You gotta go into the opposite direction. Okay. What's next?
Do the tibial band bone roll stretch.
Oh, yes, okay. Probably wanna do this side.
Okay.
And what you're gonna do is on the foam roller, like this,
Okay.
okay?
So this one will be bent.
Yeah. Just up over this. So it's on the side of your leg there.
Like that.
Yeah, and come down. And then what you're gonna do is roll.
Out like
You
that.
can bend your elbow.
I can't reach the ground.
You're gonna roll up and down that TFL.
Okay, okay. Like that.
You got it?
Kind of. I just feel really
You can
awkward.
put this foot in front of you.
That?
Yeah, and then roll.
Oh, that makes sense. Okay.
And then roll.
Feels
Okay.
good.
It does feel good.
Like that hurt good.
It hurts so good.
Okay.
Okay? Okay,
Piriformis.
say it again.
Piriformis.
Okay, piriformis on your back. On your back.
On my back.
Okay, bend both knees up. And what does the piriformis do? External rotation.
Abduction, maybe?
A little bit of abduction.
Extend.
So we have to do
Internal.
internal rotation and adduction. So you're gonna have them tuck their tummy, bring their knee up to their chest, and then hold on to it. You're stretching toward the opposite shoulder. You should feel that in your butt. And then if you have them move a little bit more, you're pretty floppy. Are we
Is that
getting
a
it?
good thing or a bad thing?
That's okay. Nothing wrong with it.
Kind of. I
You
feel
okay
it more
there?
in my hip flexors, which is kind of weird. Like there's like getting stuck there.
Oh, yeah. A lot of time people will feel that right here as they crunch that tissue together. but you have to go in the opposite direction. A lot of times I've seen people do what they're calling piriform stretches, and they come here. And that's not a piriform stretch. It has to be here.
Yeah, that's what I was gonna say. For some reason, we did ours that other way you showed us when we were in Gerard.
Isn't that the first one with the on the knee? Is that more of like a hamstring?
What?
Well, the one that you said not to do just now? This one?
That's not hamstring.
What would that be more of?
That's the internal rotators.
Okay.
So the gemelli and all them.
So, but it is like right, whenever I do it, I can feel it like right
Yeah.
in the butt area.
Mhm.
So I didn't know if that was like more hamstring or,
Yeah, no, it's not hamstrings. We're gonna do hamstrings here in a minute.
okay. Well, I'm gonna learn today then. My hamstrings.
What's next?
Hamstrings.
Hamstrings, okay.
Perfect timing.
So you can do hamstrings in many different positions. We're gonna do them in 3 positions today. So, tuck your tummy, bring your knee up to your chest, and hold on to the back of your thigh. And kind of let it loose. You don't need to pull up real high, because then you're gonna straighten your knee and keep that hip down. Don't let it pull up. You should feel a good stretch right here, okay? They're also, when they do this, because they're using their quads, they're getting reciprocal inhibition of the hamstrings in this position. So they're gonna hold that for a good 20 seconds to make it a little more interesting and make them go, ow. You can pull that up. Come on back down. And I'll have you sit on the edge of the mat, right over there. This end. And come to where your feet are flat on the floor. You're gonna get them in their good posture, right? Shoulders back and down, a little bit of a chin tuck. And then we're gonna do sitting hamstring stretches. And we've already pretty much got the hip, if she was a little taller, we would have the hip in a 90-degree flexion. But it doesn't matter, we're still gonna get a good hamstring stretch. So what I want you to do is straighten your knee, but don't flex your back. You may need to come up a little bit. Okay. You feel it? Okay. The key here is that they don't lose their lumbar, extend a little bit. There. They don't lose their lumbar curve when they do it, because relax. If they, you did lose it a little bit there, okay? When they do that, that puts the pelvis into a posterior pelvic tilt, brings that sit bone forward, and it's cheating, okay? Cheater, cheater.
Sorry. I still felt it.
Okay. Oh, I want one more position for hamstrings. And that's in standing. I'm going to have you bring your leg out here and simply lean forward on it. Keep your arch and lean forward.
So you wouldn't want us to like go down?
No. Keep your arch.
So it's more like putting
We're
your
isolating the hamstrings, we're not getting the back extensors in that one. Okay?
So we do those, we call them hamstring scoops.
Yeah. Scoops?
Yeah.
Uh-huh. What's next?
Gastrosomas.
Okay.
Mine are tight.
Okay. You can do a simple runner stretch where you keep your toes forward, heel on the ground, and lunge forward with the,
Oh, that's good.
okay. And that gets gastrocs. Bend your knee, and you get soleus.
Can't keep my heel on the ground and bend my knee.
Back up a little bit then.
Okay.
Okay. Another way to do that is with the slant board. And all they have to do, put your toes up as high as you can there. Both feet. Okay. And then just stand there. Okay. And bend your knees to get the soleus. Trick is to keep the heels down. What's next?
That was it.
I think we skipped hip. Yeah, we skipped hip flexors on accident.
Oh, okay, I knew there was one that we missed. Hip flexors, you can get it with that prone push-up that we did, okay? But one really good way to get it is, come right up next to the mat. Put this knee up on the mat. Okay. Now, in this case, they're going to do a posterior pelvic tilt. Posterior,
I feel like the AM.
flex that spine a little bit. And then step forward a little bit. And you'll feel, flatten that back.
Ah, I feel like the table's too high.
Is it?
A little
Let
bit.
me do
Like
it
I'm
then.
all
Let
crooked.
me do it. If you come here, you gotta do that tilt and then come forward. You're gonna feel it in the quads, and it's also gonna get the hip flexors at the same time.
And they said something about like the Thomas position, so
Yes.
like when we're doing the Thomas test.
Yes.
And you can do the same thing, just let them rest there.
And you lay on your back. Come forward to where just your sit bones are on the mat. And then I want you to lean back and bring one leg up with you. And lean back and let the other one just hang. Okay?
Yeah.
And that really gives a good stretch too. You could put, if you needed to, you could put a weight on their thigh. Pull that down. Come on back up. Did I get everything?
Okay.
Okay. Forget what those other boxes had in them. I want to show you a scapular retraction exercise that's really good to help retrain for that retraction and depression. And everybody put their hands up here. Turn your pinkies out and then pull down. And make sure those pinkies, if you're trying to get a little more protraction and depression, move those pinkies out. Okay, let's do it again.
Feels good.
Yeah.
Up, pinkies out, and come down.
Jeff Bridges was
I'll
on
have
the
to
phone
remember that
last
after,
night,
like,
and he's there. Oh me.
Arm day.
Yeah.
For like
Oh, yeah.
5 minutes, it's just like these deep, raspy man voices, like oh. It was funny.
She's like, my 10-year-old will set her up.
Okay. The other two boxes are things that we're going to pick up in the other chapters, so I'm not going to go over them right now. But you might want to look at them and kind of have an idea what they are.
14.3 and 14.
Just in case, I haven't put the test together yet. Just in case there's a question That requires critical thinking and knowing what those things are.
On which boxes, the 14.3 and 4?
All the
I
boxes.
think so, 'cause that's the unknown stuff in the chapter.
Any questions about postural retraining? So you're gonna identify which muscles are tight, which muscles are weak. You're gonna stretch the tight ones, you're gonna strengthen the weak, the overly stretched ones. You're gonna teach postural awareness. And with everything you do, I don't care what you're working on, you're also looking at posture. Okay?
He's sitting like that.
Yeah.
Well, you know, and there is that fatigue factor. Your muscles aren't used to working in that way. So one thing the book talks about is setting up some kind of an external cue for your patients. They might set up some kind of a timer so that when they're working, it'll ding every so often and they can correct their posture. Because they're going to go back. But you just keep reminding them.
We had a patient that we treated with OT, and he had really bad upper posture, so they put him in front of the mirror and made him just sit there and look at himself.
Mm-hmm.
I mean, and then they would add in like weight exercises to make him watch himself.
Right. We do that a lot too with neuro patients. Your TBIs and your strokes that don't have a good sense of midline, they can see it in the mirror and it helps them correct it because they don't feel it. But also we do it with orthopedics. So say you've got somebody with a shoulder problem and they want to flex their arm like this, put them in front of a mirror and say, you got to keep this down while you move that arm.
They don't realize what.
And
they're
it gives
doing.
them some visual feedback. It's biofeedback. How about that? Okay.
Bye.